Centricycle social venture. My name is Carrie Urena, and these are my teammates Alex Chinat, Nabil Salko, and Harun Afzal. There's also 2 members on our technical team that couldn't be here today. So before I get started, I want everyone to close your eyes for a minute and think of everything that you have to do for the next 7 days. Exams, reports, presentations, papers. Now imagine if all these things you had to do while physically exhausted, mentally tired, and you can't think clearly. Also think if you don't have much time to do this because you have to sleep extra hours each night. This is something that 1.62 billion people have to endure every day due to anemia, a problem caused by not enough healthy red blood cells. And that figure is only rising. Anemia is the world's 2nd leading cause of disability. It is a dangerous recursive cycle. It affects both the economic situation and healthcare in these locations. So you see on the left, or on the right, it decreases productivity, which leads to decreased funding, which means that these people don't have money to get the treatment and go to the hospitals that have these tools to diagnose them. And then on the left-hand side, it's dangerous during pregnancy because the mother does not have enough nutrients to sustain herself and her child. It can cause increased maternal mortality, increased infant mortality. If the infant actually survives, it leads to decreased mental, physical, and emotional development.
This is where we come in. Centricycle has created an affordable, sustainable centrifuge made almost entirely out of bicycle parts, specifically tailored for use in developing countries. Our product breaks the cycle of anemia by providing a local, effective means of diagnosing the condition. Individuals in these communities can get local help, and once their disease, once anemia is identified, they can be directed towards the very cheap and effective means of treatment.
And these means of treatment, in India, 80% of the population is affected with iron deficiency anemia, which is easily cured with iron tablets. But the real problem is in lack of diagnostic tools and education. We plan to target India for this reason, as well as there's a high prevalence of bicycles. They're the world's 2nd leading producer. There's also 2 main types of bicycles, which will allow us to standardize our design. There's a huge addressable need because India has over 1/3 of the world's population for anemia. They have over 540 million anemic people. But we see our addressable market as 202 million of these people as people who are poor in rural communities that have lacked access to healthcare. And by selling your device at $25, we have a market size of $12 million.
As India's healthcare system is divided up into 3 main divisions that we've identified, and these are based on the number of people that each of these style of clinics can reach. So at the lowest level, these sub-centers are actually located in the rural villages themselves, and they lack even the most basic medical technologies. And moving up, the primary centers have more resources at their disposal. However, they also lack means for effective diagnosis. Essentially, they lack a centrifuge and electricity. And these community centers serve large numbers of primary and sub-centers and can serve whole regions in India. And it's by working with these clinic customers that we hope to bring social impact in these 3 categories. So in economic, we've estimated that we can bring $7.4 million in benefits to the Indian government. And that figure results from the increased productivity of a healthier workforce, as Carrie mentioned earlier, of the extreme exhaustion and inability to work. So in fact, healthier people are 17% more productive than anemic individuals. And in terms of healthcare, we hope to reach 0.1% of India's rural market within 10 years of operations. And that translates to a very large number of pregnant women and children. And it is these individuals that we hope to reduce the incidence of anemia-related morbidity and mortality. And in terms of community development, again, as Carrie mentioned, the problem is not the availability of treatment, but it's of education. It's a problem of the awareness of what anemia is, that there's a problem at all, and that the proper means to get treatment, and that there are resources such as our product that can identify the disease. So that's what we want to build in community development, the education.
So we plan to go about implementing this device by setting up 2 centers, both in the United States and in India. So in the United States, we'd be doing such work as prototyping our device and doing the validation of it, as well as fundraising and talking to angel investors. In India, we would be doing the actual selling and marketing of our device, and that's where our real value proposition is, by having people along the way on every step of our product. So here's a breakdown of our staff that we have. So in our main office, we'd have the management team as well as technicians. One of our key people that we have is we'll have awareness consultants that will go to the locations where we've implemented this device, get feedback, see what situation is there, and then send that information to the United States so we can make updates to our design and do further testing. Finally, we'll have trainers in the villages that will work with these places to make sure that the device is used properly. And eventually, as we scale up to work with NGOs, we will have these people train the NGOs how to use our device as well and how to build it. So we've already started this process, and we have a few key partners. The first of these is ATC, the Appropriate Technology Collaborative. They're working with us this summer to do field testing. We're going to the Swami Vivekananda Youth Movement, which is a medical center that we will be doing initial testing. And eventually, as we move forward, we'd have initial contact with IndyCorps, which is a huge organization that's established in many rural areas in India.
So Centricycle has divided up our expenditures into 3 main categories up here. And we've also, of course, done a more detailed financial analysis. And in the interest of time, going to skip over this. However, if you guys have any questions, I'd like to direct you towards Haroon, our fantastic financial director. And so for our first year, our cost breakdown, our first year is very important. And most of our costs are based on the field testing that Carrie had mentioned. And this is crucial because we'll be doing a lot of our customer discovery, working out the budget models of our customers, the 3 different clinic tiers, as well as working on the cultural awareness in these communities. And so we've been applying for grants, and we'll actually be hearing back from Dell's Social Innovation Grant later today. We've currently applied to the E-Teams grant, and of course we are focusing on revenues from direct sales of our device, which we'll be selling for $25. And what we will be selling is a small parts package that contains components necessary to ease construction of the device, as well as an instruction manual made entirely out of pictures to help bridge the multitude of languages that are spoken in India.
And just to interject in, the Dell Social Innovation Competition, we're actually semi-finalists, so we're hearing back and we made it to the finalist round today. So, besides the external threat, we have a couple of external threats as well when we actually start implementing this device. So the first of these is electric centrifuges. They're the industry's main standard and are used in the bigger hospitals. However, many of these rural locations lack access to reliable electricity.
Additionally, electric centrifuges can cost over $1,000, and as I had just mentioned, we are going to be selling ours for only $25. And there are other manually powered centrifuges out there. However, these have a very low sample size, as you can see right there, 2 samples. And they're made out of highly machined, specialized parts. So if maintenance were to be necessary, it would be incredibly difficult to replace anything on something as you see there. And the standard in the most rural sub-centers is clinical inspection. And this basically involves a doctor examining the anemic individual for signs of facial or hand pallor. And as you might guess, this is not as accurate as standardized medical tests, and it's only effective on young children who have thinner skin and the most anemic individuals, as this boy is here. And finally, chemical diagnostics involves placing a blood sample on a small strip, and we hope to look to partner with them, actually.
So we have a couple, besides those factors, we have internal factors as well, dealing with the cultural acceptance of our device. So we have to make sure that people will actually use our device to do these diagnostic testing, as well as that it'll be user-friendly so that they will be able to use it even if they don't have the technical skill.
And preliminary research has indicated that there are rather low regulatory boundaries in India. However, some surprises may come up which could pose barriers for us. And we have four main critical success factors. Most important among those is sustainable funding. Obviously, since our value proposition focuses so heavily on continued presence in India and working closely with them over a long period of time, we need money to do that and not just lump sum grants.
We'll also need partners with NGOs so that we can reach a wider audience. If we only have one center, we'll only be able to reach a small group of people, but as we expand, we'll need to have partners to do that.
And of course, the cultural acceptance, thumbs up right there. So to build on our current progress, we've outlined some next steps up here. And just to basically skip over those really quick are finalizing the device itself, the sustainable funding, and the field testing this summer, which if we do obtain adequate funding, we will be doing independent study in India in a winter semester 2011-2012, which would be a fantastic experience.
Yeah, we're very dedicated to seeing this device go actual places and actually make an impact in the world.
So we have learned an incredible amount this semester, and we came into this class basically with just a device and our engineering knowledge about it and a lot of false assumptions. So we built, our initial idea was essentially that we could stay in the United States and give this product to NGOs all over the world, and they would take it everywhere and implement it and distribute it and essentially run our business for us. And we've of course realized that that simply is not going to happen. And we've realized that we need to work very closely with our customers, and we need to give them an incentive to work with us in terms of partnership, as well as the incredible importance of financing, which is very apparent now in terms of the large grants that we've been trying to get for. So thank you very much, and we'd be glad to answer any of your questions.